you are the medicine yourself.
What does it mean?
Everybody of us carries approximately 500 mutations. Not everybody gets these 500 diseases.
Professor Dr. Rejko Krüger is a brain researcher. Over the last 30 years, he had published more than 350 scientific papers. He is also a practicing doctor, and he is treating patients while trying to solve the mystery behind brain changes that occur with aging.
There are some unexpected factors.
The disease that you get at 30, which kills you at 70.
There are so many things in life we cannot change, but this we can change.
Should I start getting concerned? Professor Krüger, what is the most fascinating secret about brain?
What I like most about the brain, that it is always adaptive, that it adapts to the environment and that has a capacity to be plastic, to react. And this is for me very fascinating because the capacities still remain during the life.
What do you mean being plastic?
You have to imagine that the brain is a very complex organ that consists of a lot of connections between different neurons and cells that support the neurons. And the neuronal activity, that makes up our thinking, our reactions, our movements. And this plasticity means that there's a constant rewiring happening. That's during our lives. Most happens in the early days. Therefore, it's very important to have a lot of visual, auditive, sensual input into the brain, because the more input you have, the better your connections are. But it still stays active throughout your life. So you can always adapt. Even if there's a severe incident like a stroke, there is a capacity to regain function. And that is very fascinating for me.
Yeah, that's really amazing. I have another question. So you're a famous brain researcher. Could you tell us a bit more why the topic of brain health became so popular now in last years?
And I think it's very recent indeed.
Yeah,
because as a neurologist, I'm confronted with many diseases related to the brain. And many of these diseases that are in my focus, neurodegenerative diseases, occur with aging. That means, and you may all be aware, we are all getting older, and that's good because that's a medical progress. But it's not necessarily that we get older in good health. And I think this is our interest, and this has been more and more recognized, that if we want to get older in good health, we have to do something. And this is why research about brain health came up, that we do not look only into early detection of diseases, but already consider how we can prevent diseases in the future.
This means that people will be able to become older without having all these things with the health, right? So they will be more healthy in the aging. This is what is meant.
This is what we envision, and here we learned a lot. So I have to say, as a neurologist, but also as a scientist, I'm looking for evidence to offer not only treatments, but also to offer preventative measures. And what we learned over the last years, that indeed some things like dementia, neurodegenerative diseases like Parkinson's, that's not given that you get it, but even if you carry a risk within you, that can be modified, and that can be constantly modified. We talk about modifiable risk factors, and you can act on these modifiable risk factors and reduce your risk to either get a disease or to slow down progression. And that's something that is more recent that we become aware, but that offers a lot of opportunities, I think.
But there is a lot of confusion between these different words, dementia, Alzheimer, Parkinson. Could you explain what is common in between and what are the differences?
And that's a very good point. I have to admit, when I was studying, there was still a big difference between Alzheimer, which was typically defined as dementia symptoms, loss of memory, for instance, compared to Parkinson's, which everybody knows as a shaking palsy, which is defined through motor impact. If you wish, I could illustrate that.
Yes, please.
Because these are, in a way, two areas. And you can imagine that there's the Alzheimer part, and this is characterized through the loss of cognitive functions. That means the first thing that people are aware, if you talk about dementia, is that you lose your short-term memory. You go to the cellar, you want to bring something up, and then you don't remember anymore why you went there. This happens also under normal conditions. That should not frighten anybody. But this is what we consider as Alzheimer's disease, as a prototypic dementia. There are other dementias, and that it becomes interesting because it's also Parkinson's disease.
So Alzheimer is a type of dementia, right?
Alzheimer is the most common form of dementia. And what I want to illustrate here in order to show that there is an overlap zone between what we call dementia disease, Alzheimer's disease as a prototype, and a motor disease, Parkinson's disease, because unfortunately also people that have trembling, that have stiffness, which characterizes Parkinson's disease, can develop symptoms of dementia during their life. So they also can lose cognitive capacities. And that's, I think, a very important point to consider, that if you are diagnosed with Parkinson's disease, you can still do something against not getting demented, for instance.
But there are also other types of dementia, right?
Indeed, there are several types of dementia. Parkinson's is the most common after Alzheimer's dementia, but we have other forms that sound more complicated, like frontotemporal dementia.
That sounds really complicated.
Lewy body dementia. These are all subtypes. What I can say is that these subtypes, in a way, provide different fingerprints so that a neurologist could see based on a neuropsychological testing. So here we invite our colleagues from psychology. Based on a neuropsychological testing, we can identify different patterns. And these patterns can define which dementia is underlying. So the different patterns of dementia reflect in a way that for Parkinson's disease, you have more problems with executive functions. And with Alzheimer's disease, you have more memory complaints, for instance.
What role does genes play in all that? Does it mean if we have certain genes, we will inevitably get dementia? Let's put it this way.
And here I would like to start that, of course, we have all genes, and that's good. But indeed, and just to be aware, in average, everybody of us carries approximately 500 mutations, we name it, if a gene is not correct. But luckily, not everybody of us gets these 500 diseases. So apparently there are differences in the expressivity of genes, even if they are mutated, even if they're disease-causing.
What does it mean?
So the expressivity, you mean? Yes. So you can imagine, let's guess there is a gene that it could provoke Alzheimer's disease. And if there's an alteration, that could be that you have a higher risk to get Alzheimer's disease during your life. For the majority of genes we know, it's not contributing 100% probability, but rather contributing a susceptibility. And it is depending on other factors. That could be other genes, but that can be also, and that's more and more recognized, environmental factors that could bring you over the threshold to develop symptoms of a disease during your life. And if you wish, I could also illustrate that part, because
yes, please.
I think that's something that merits some attention. I can briefly wipe it out here. And what you can imagine is that there's different ways which defines our susceptibility to disease. Let's assume here we have genetic causes, and here we have environmental factors. And you can imagine that there are very rare forms of disease, and that refers to Alzheimer's disease or to Parkinson's disease, where you have 100% a genetic contribution. So these are the genes that play a role. And if you're here in the spectrum, you may have a family history. That means you may have somebody in your family that also had dementia. And if you think back, it was the grandfather, maybe even the mother of the grandfather. So you really can track it back in the pedigrees. That speaks for a very high risk that a gene expresses in 100%. And this occurs here. Then you do not need any environmental contribution, but you only have the genetic contribution. And then you could say if you carry that mutation, you have a close to 100% probability to get the disease. This is very, very rare. This is less than 5% for Alzheimer's and Parkinson's disease. But we have also the other extreme, that we have only environmental factors that drive a disease. We knew that from Parkinson's disease. In the 80s, some drug addicts took a drug that was contaminated. And that contamination was called MPTP. It's not so important. But that could kill dopamine-producing neurons in the brain, the neurons that are affected by Parkinson's. And within a short time frame, they all got Parkinson's disease. Wow. That was a toxic insult. But for the
So even back then, you could trace this connection between drug contaminated drugs and Parkinson's.
Exactly. It was not me. It was Bill Langston. But he became famous. And just to make aware, that was neurologists that found it. That were neurologists that found it. And it was very important because it was the first time to show that Parkinson's can be induced by environmental factors. Something that is a major focus of interest still today. In the meantime, we identified genetic causes, which helped us to understand the underlying mechanism. But the pesticides are now also discussed as an environmental factor that could contribute to Parkinson's.
And dementia, the same?
And for dementia, in principle, it is the same. So we name it here, the so-called monogenic cases where only one gene is mutated and you get the disease. And you have more environmental causes that are intoxications that can be with heavy metals, for instance, that mimic dementia. And what I think is the most important point, that the majority of people is somewhere in between. So you have some of these mutations, some of these altered genes. You may not necessarily get the disease, so the expressivity is low. But if you are here, for instance, then you have this part that needs to be environmental, that comes in addition to your susceptibility to develop the disease. So if you protect yourself from some environmental factors, you could protect yourself for getting the disease, because only if you reach that level here, you get the disease.
Well, the dementia develops silently over the years, and only you notice that when you're old mostly, right? And I even saw now one famous blogger made an episode, and it was called the disease that you get at 30, which kills you at 70, something like that.
But that refers to an important point, if I can add to that, because indeed, the process that leads to symptoms that you may even recognize yourself, like dementia, that process starts many, many years before. And this is also what we learned. How could we learn? Because even a neuropsychologist who makes a lot of tests with your brain would not find symptoms. But if you look into the blood, if you look into the so-called cerebrospinal fluid, if you do a lumbar puncture, we can derive biomarkers that indicate something is going on. For Alzheimer's, it's well established. For Parkinson's, it's still under research. But for Alzheimer's, we can really say if you have a certain pattern of biomarkers, certain proteins that are increased in the blood, increased in the cerebrospinal fluid, you have an underlying process that has a high risk to lead to Alzheimer's.
So you can get tested already now for that?
You could get tested now. That makes, of course, most sense if there is already something that a person feels. I'm not as, I'm not as fast in thinking as before. I have some memory problems. Then you could make that examination. You could reassure that person that the neuropsychologist doesn't measure anything, and also in the blood values there's nothing. But if you find something that could justify to already intervene, to look what are your risk factors that you could work on.
And if I don't feel anything, if I'm fine, when I should start getting concerned, or should I start getting concerned about that?
I would phrase it the other way around. I would say you should think about your brain health even before you are concerned about that. Because I think it's important that we learn that we can do a lot ourselves for our health. And that this may require activity before the age of 60 or 70, but much earlier in life, in order to prevent something starting or slowing down, something that started already, not to develop into a disease that you feel, where you get symptoms.
Yeah. So what can we do ourselves?
And that's something we learned over the last years. There's scientific evidence for, in the meantime, 14 different so-called risk factors. I prefer, and I was at a meeting in Geneva last week, to call it hope factors, because
that's a nice expression.
Yeah, because it's really, you must be aware that's something we can act on. There are so many things in life where we say we cannot change, but this we can change. Yeah. And these are factors that we can easily address, like not to be too lazy, to do sports, to do activities. These are not only physical activities, but also cognitive activities, going out, visiting an exposition, going to the theater, going in a cinema. That all stimulates your brain, and that's important. We have, of course, factors that you should discuss with your treating physician, like not having too high blood pressure. So regulating the blood pressure is a hope factor. Regulating, recognizing a diabetes and treating well is a hope factor. And these are all factors that play a role. There are some unexpected factors like social isolation that we should prevent that can already reduce dementia risk or risk for these neurodegenerative diseases. Similarly, problems with hearing. So you should correct if you have trouble, because it was shown that this increases the risk to develop dementia.
Is it connected to social isolation?
It's not the only explanation. So there must be also a kind of pathophysiological context. That means, again, I talked about plasticity of the brain, and maybe an input that is lacking, not to stimulate plasticity, that could play a role. But it's an underestimated risk factor, and we should take efforts to act on that and convince our parents to wear the devices if they have a problem.
Professor Krüger, Japan is often described as the world's first super-aged society, and Japan is already ahead of Europe in this sense. What do you think we can learn from them?
That's really true. So the Japanese society is aging a lot, and that, of course, imposes some challenges. We see it for the risk for neurodegenerative diseases, that it increases. So there's an increasing number of people affected by Alzheimer's disease, by Parkinson's disease. Parkinson's is even worldwide the fastest growing neurodegenerative disorder. And that means that we have to, of course, think about prevention and how to bring prevention to the people. But in the first line, it imposes also a problem in how to deal with the care needs that these people require. And here we see that Japan, and that is now a different, let's say, cultural context. They have the problem that younger people move to the cities, and the elderly people are more in the small villages outside in the landscape, and therefore they have to provide structures that capture the people, and they invest into digitalization. And that's something we can also benefit from in the future. So there are tools in order to, in a way, support care of people that are demented. That can be tools like robots that support during care. There's even a small robotic animal that makes noises that calms people with severe dementia.
Wow.
That is something that was found out in Japan. And it helps also in earlier stages to have digital tools in order to prevent dementia. So that what we talked about in terms of risk factors, that it is something that can be addressed easily through cognitive training delivered by digital tools. So in Luxembourg, in our dementia prevention program, we have integrated these kind of digital tools to incentivize people to train their memory, to train their cognitive functions. And you can imagine it's a little bit like in a fitness club, where you strengthen your muscles. You can also strengthen your brain by using cognitive tests and cognitive essays.
But we also have an application, right, in Luxembourg in dementia prevention.
And that is even something that should help you even before. That means even a healthy person that may not be concerned to have some problems can use our app, the so-called Brain Coach, in order to see, are there any risks that I have? And is there something today that I could address with acting on my lifestyle in order to prevent me from being at risk in the future?
Yeah, that's true. But it just in general, motivation is a key, because in order to avoid these risk factors, you need to be really motivated to make lasting life changes. What would be your advice to our viewers? What can they do? How they can motivate themselves?
And that's a good question. So in our program, we have so-called memory coaches that try to find out what are the areas that can be improved and to identify individual motivations. Of course, we don't want to impose something. We want to convince people. That's the first thing, that you're aware of your risk and that you're open to act on it. Our friends from Netherlands had a campaign that said, you are the medicine yourself. So we want to empower people. It's not that we prescribe something. It's really that we can offer options where they can embark on. And in terms of motivation, there's a good news, let's say, because everybody knows being more active, doing some physical exercise is beneficial, not only for your dementia risk, but also for cardiovascular risk. And studies show that it doesn't matter so much what you do. So you can really embark on something that you like. You don't have to do jogging if you don't like jogging at all. Even if you gain then time in healthy life, you don't use it because you spend more time in jogging. So I think you should really focus on something that you like, and that can be dancing. For Parkinson's, even it has been shown that Tai Chi is effective. So going on a bike, doing sports in any way that is of fun should motivate you to do more.
Yeah, so fun is a key word.
Very important point.
But still, changing habits is complicated. What is your favorite? What do you do? How do you hack your brain? How do you trick your own brain if you doesn't want to do something?
Yeah, I think for me it's very important, and I think Luxembourg is a very good environment for that you in a way confront yourself with new things, that you get out of your comfort zone. And in Luxembourg, you have a multilingual environment, which forces you already to adapt language-wise, but it's also a multicultural environment, which gives you a lot of opportunities to hear about new styles of music, new kinds of art, new theater plays. And you have to, in a way, you have to stay curious, and you have to go out and you have to look for what is new to keep up with what is developing. And if you leave your comfort zone, you get the stimulation you need to get your brain activated. And for me, it's a big motivation.
So basically, if you train your brain always to be curious, it stops saying, okay, no, I don't want certain things.
Yeah, it depends on your attitude, on your drive, on your energy, and that you have in your own hand.
Okay. Thank you so much for this interview.
Thank you.